Malaria is a life-threatening disease caused by a Plasmodium parasite. It is transmitted through the bite of an infected female Anopheles mosquito. Once an infected mosquito bites a human, the parasites multiply in the host's liver before infecting and destroying the red blood cells. People who get malaria initially present symptoms and signs such as fever, chills, and headache. If not treated promptly and effectively, it can progress to severe illness leading to death. Although malaria can be a deadly disease, it is preventable and curable. All persons in Ghana are at risk getting malaria. However, pregnant women and children under 5 years are at higher risk of the disease. In Ghana, malaria remains a major cause of illness, poverty, and low productivity. In 1999, Ghana committed itself to the Rollback Malaria Initiative and developed a strategic framework to guide its implementation. Currently, overall goal of the National Malaria Control Program is to achieve a 75% reduction in morbidity and mortality by 2020, using 2012 as its baseline. A number of strategies such as LLINS distribution, prompt diagnosis and effective treatment, as well as intermittent preventive treatment for pregnant women are being implemented across the country. Interventions like indoor residual spraying, IRS, and seasonal malaria chemoprevention are implemented in targeted areas of the country. According to the Ghana Malaria Control Program's 2017 annual report, the disease accounted for about 10.2 million suspected cases recorded at OPD. Out of the 599 malaria deaths recorded in 2017, 327 deaths occurred among children under 5 years. Despite the progress made, there are still gaps in achieving elimination of the disease. Particularly, what has remained a key concern is the state of the country's prison facilities, which are primarily designed to support the reformation agenda. One of the key challenges that managers of the country's prisons have had to grapple with is infestation of the facilities by mosquitoes and other insects, and the attendant incidence of high malaria cases among prison inmates and staff. In 2005, AngloGold Ashanti, the mother company of AGAMal, identified malaria as the biggest public health threat to its operations in sub-Saharan Africa. In view of this, a comprehensive malaria control program, AGAMal, was launched in 2006 to address this menace, which was impacting productivity on the company. The initial objective was to reduce the burden of malaria in Obuasi by 50% within the first 2 years of IRS strategy. Within 2 years of program implementation, malaria cases recorded at the Mines Hospital had reduced by 74%, exceeding the initial goal of 50% set at inception. The success of this initiative attracted donor funding from Global Fund through the efforts of the National Malaria Control Program and other stakeholders. AngloGold therefore incorporated AGAMal as a limited liability entity to attract external funding. Since inception, AGAMal has partnered the Ministry of Health, the Environmental Protection Agency, Ministry of Local Government and Rural Development, etc., with funding from the Global Fund to scale up the indoor residual spraying, IRS, to a total of 25 high-burden malaria districts in Ghana. To ensure the program's long-term success, AngloGold Ashanti established the Obuasi Malaria Control Center at its Obuasi site. His Excellency President John Agyekum Kufuor in 2006 commissioned the center. The center currently serves as a training facility for AngloGold Ashanti's malaria projects at other mines in other parts of the world. In recognition of the need to make the prison facilities and homes of prison officers conducive for human habitation, the Ministry of Health and the Ghana Health Service, through the National Malaria Control Program and the Prison Service, with support from the Global Fund, Unit Aid through Engine IRS and AngloGold Ashanti, contracted AGAMal to spray all prisons in Ghana as well as prison staff quarters as a result of the vulnerability of the inmates of the prison and staff to malaria. Under this initiative, the team worked in 43 prison sites and 30 community staff quarters across the country. In all, an estimated 13,707 structures were sprayed with 2,742 units of Sumi Shields 50 WG insecticides within a 10-day period. The Ghana Health Service, a key implementing agency under the Ministry of Health, is a key partner in this project.
We don't, as a health sector, we don't discriminate against anybody, even though prisoners, somebody will say that maybe they've done something wrong and they're incarcerated. But we believe that they are also a residual place for malaria. So what we decided is to control the vectors in the prisons. And in so doing, we are not only trying to let them be malaria free, so that mosquitoes will bite them, and when they come out and the mosquitoes will go there, bite even the warders and bite the other people, then it will be spreading. So we want to cut down the malaria morbidity in the prisons. And that's the reason why we have decided that AGAMal, who is a principal recipient and who have experience in indoor residual spraying in one of the regions, was contacted to go and try and see if they can spray all the prisons in the country. And they are doing that to first control the vector, and as well as other insects like bed bugs and other things which cause disease. So AGAMal is doing that. They sprayed almost all the prisons in this country, and I think is a way that we have to go to cut down the morbidity of malaria.
The National Malaria Control Program has remained a key partner of AGAMal over the years, and they're excited about this partnership.
AGAMal is one of the partners that we work with when it comes to malaria control. In fact, it's the only private sector company that is working with us to address the public sector needs on malaria control on that large scale. AGAMal is responsible for undertaking indoor residual spraying in parts of the country with resources from AGAMal itself and Global Fund, working together with a government institution in these places. What we do periodically is to take children under 5 years, take their blood and test to see if they have malaria. We've been doing this consistently over the years. In 2011, we did that as a country. Our average was 27.5%. So if you take 100 children, about 28 of them were positive for malaria parasites. We did it in 2014, it was 26%. And we did it again in 2016, it was 20%. What we realized is that there's been a drastic reduction of this malaria parasites prevalence in the regions where we have indoor residual spraying. And I'm talking about regions like Upper West, Northern region, where indoor residual spraying is also occurring from our other partner, and in Upper East, when we had the indoor residual spraying between 2011 and 2014. All the other interventions are going on across the countries, but you can obviously see that the addition of the indoor residual spraying in these particular regions is making great impact on malaria prevalence.
The program director of AGAMal, Samuel Esiedu, highlights the AGAMal model as well as the importance of this program to ridding the country's prison facilities of malaria.
AGAMal, having had a successful program implementation in Obuasi, had donor support from the Global Fund in partnership with Ghana Health Service along with NMCP, that's the National Malaria Control Program, to extend the program to the entire Upper West region and 3 more districts in Upper East. Having been successful with that, we also saw the need to extend this program to the prison service, where the inmates are very vulnerable to malaria episodes. We need to protect everyone in Ghana. So indoor residual spraying was the best appropriate measure that we can put in place to protect both inmates and officers in Ghana prison service. So we had a support from the Global Fund, and we are here today to put lethal dosage of our chemicals on the wall, so that as these mosquitoes settle or land on the wall, they take a lethal dose and that kills the mosquito either in the course of the day, so that malaria can be prevented in Ghana Prison Service.
Records available at the Ghana Prison Service show that in 2015, there were 6 pregnant women, nursing mothers and babies admitted at the country's prisons, compared to 16 in 2012. This is a highly vulnerable group as far as malaria infestation is concerned. AGAMal, together with partners of the project, have brought back joy among the prison inmates and officers of the service. The prison service was very thankful for the initiative and expressed how the initiative will go a long way to fight malaria in the prisons.
On behalf of the Director General of Prisons, the members of the Directorate, I want to say a very, very big thank you to AGAMal and all the wonderful sponsors. Without this program, I think the mosquitoes will just be biting us here and there. But by your kind grace and mercy, I believe that we'll taste some peace and we'll sleep peacefully in our vicinity. So we are very, very grateful, and God bless you all.
We would also like to acknowledge the support that we receive from Unit 8 through Engine IRS project. They have been on board, and they also do some amount of co-payment for our chemicals. This is very crucial. It's helping us expand our program. We used to be limited to just the Upper West region in terms of our operational area, but having the co-funding component from Unit 8, we are able to expand to 3 more districts, and that is great.
The AGAMal model is built on partnership, and so we are inviting other corporate bodies and stakeholders to join forces in tackling some of the real issues that confront us as a continent.